In today's episode, I'm joined by Heidi Moretti, who graduated with a Master of Science in Nutritional Sciences from the University of Washington in '99. She's a registered dietitian and knows a lot about the gut, in particular about gut issues and how to heal them. She in fact wrote a book, The Gut Fix, which is available on Amazon, and in today's episode we're gonna discuss common gut issues and how you can fix them. There are a lot of people with gut issues. Everyone I talk to has some sort of issue related to the digestive system, and most people don't understand that you can make a couple of very simple changes to your diet, to your stress levels, to your lifestyle to fix those gut issues once and for all. So join me and welcome Heidi Moretti. All right, so welcome to the show, Heidi. It's been a while since we last chatted, and in the meantime, a lot of things have happened. You released a book, right?
Yeah, definitely.
Yeah, very, very cool. And let's talk about gut health. One of the things I've noticed that, usually gut health is not something that you talk to people a lot. If you meet someone, the first thing you say is that, hey, I have actually gut issues, So that usually comes up then later in a conversation if you, continue, engaging with certain people. But interestingly enough, the more I bring up gut health in discussions, the more it turns out everyone has gut issues, right? To varying degrees. There are very few people that can say, my gut feels absolutely fine on most days. From bloating, diarrhea, constipation, just feeling not great, acid reflux. There are so many variations of gut issues, many of which, there are many that are diagnosed, right? And there are some that it's like an exclusion diagnosis. If it's not any of the other thing, then it's, IBS maybe, or, some of those other acronyms that I'm sure we're going to touch on. And so you've dealt a lot with people that have gut issues, and you have a good idea of what it takes to A, prevent them, and B, heal them once you have reached a certain point. You actually wrote a book about it. So, let's talk about, what are some of the most common gut issues? What are some of the symptoms of those gut issues, and where do they come from? Why does everyone have gut issues?
Yeah, it's so true. I think 66% of people living here have something diagnosable, and you're right, almost everybody else just hasn't had it diagnosed yet. In my experience, it runs the gamut, and usually people have at a minimum heartburn occasionally, and then often in combination with some level of constipation or diarrhea or irritable bowel. Now, a lot of people wonder the distinction between irritable bowel versus just having constipation. And the major distinction is having gut pain that's chronic, or at least a good chunk of the time. So, yes, it's extremely common, and it's and it's typically like a pretty simple fix. Getting to the root cause is always a diet factor, or missing nutrients, or stress. So there's a lot of low-hanging fruit for people to really take on. And sadly, I think what happens though is they go to the doctor, they say they have gut pain, maybe a 5-minute conversation without anything about food is brought up, and then they get a pill, whether it be the new Linzess or it's an acid blocking drug, and still they may feel a little better, but have to live with the long-term side effects of the drug. They may never be taken off this drug, and it's got its own set of harmful issues over time. So the magnitude of the problem is huge. And I think, the main reason I took on the book is because of the magnitude of the problem, without people still feeling fairly frustrated when they come out of the doctor's office and they tell me, well, they didn't find anything on my scope, but I still feel terrible. They don't have a solution. So, and, I think there are a lot of great solutions, and you've found a lot for yourself and, people you've talked to, I know. So I think, I think at the crux of it is people just don't have the awareness of the things that they can do to heal. And there's a lot of tools.
Yeah. Yeah, and it's so funny that, as you said, that it's such a low-hanging fruit. I mean, it diet, stress or nutrient deficiencies. I mean, those are really the big three, and they can be fixed so easily, at least on paper. And now changing a diet is not easy by any means, depending on what if you've been eating a certain way for decades, changing that and getting out of that what you think is healthy and what everyone tells you is healthy might not actually be healthy at all. And whenever someone then says, but what you're doing is not healthy and what I'm doing is healthy because that's what my doctor said, I'm like, well, then how come that I feel good and you're not?
Right.
At
Exactly.
the end of the day, it proves in the pudding, right? If something makes you feel good, chances are it's good for you. If something makes you feel not good, then maybe it's not so good for you, regardless of what your doctor tells you. And so,
Absolutely.
so diet. What are some of the biggest dietary factors that influence gut health or that can destroy your gut health? And how does a healthy gut look like? How is it supposed to feel and look from the outside if you have a healthy digestive system? Maybe let's start with that.
Right. Yeah, that's a great place to talk about it. The biggest problem here is refined carbohydrates and sugar. It's a fairly direct impact on the gut. The sugar goes into the digestive tract. The bad bacteria have a heyday with it. They grow, they expand, they cause bloating. So whether it be sugar from soda, donuts, candies, muffins, pumpkin spice lattes, right? It's all the same in terms of it's gonna cause a lot of gut distress. And if you have a muffin along with it, right, or a donut, or the break room has bagels, and it's just the constant onslaught of processed carbohydrates that are the biggest problem for most people. So that all has a negative effect of the gut, bacteria, causing bloating, causing pain, causing constipation, sometimes even diarrhea, because there's no real substance or nutrients to support all this carb. And I don't think that's a factor even a lot of healthcare professionals think about, is the lack of the nutrients that come with those carbohydrate foods. And that's just causing more insult to the gut lining.
Right.
And the reason the lack of nutrients causes damage to the lining is simply the cells don't get the nutrients they need to have a good structure and function. And nutrients are the building blocks of everything. Gut cells, they're the building blocks of the probiotics in our gut, and it's hugely neglected. Even when I worked in the hospital, we had such limited tools, like, someone would come in with terrible gut issues, and you would say, well, I'm sure they're malnourished, they don't have enough nutrients. But the thing is, like, our tools were so limited, we could give them some artificial compounds from the pharmacy as so-called vitamins, and then hope for the best, and maybe they'd get a high sugar Ensure, because they're on a full liquid diet. It's just a hot mess.
Yeah.
So I think those are really the low-hanging fruit as far as the causes of the major issues. There's more to the story. I mean, intolerances play a big role as well.
And
And I think, yeah.
I want to bring it up because I noticed that, my gut issues when I had what I guess was IBS, irritable bowel syndrome, which because there was no better diagnosis, so the doctor said, well, it's IBS. And I've noticed it completely went away when I changed to a paleo diet. And at the time, paleo eating for us meant a piece of meat and a side of veggies, usually grilled zucchini or something simple, and the issues went away. And then when I went on a keto diet, those issues actually returned to, maybe a lesser degree, but I felt suddenly gut issues again, despite the lack of processed carbohydrates, right? And I realized that, well, for me, and I think that's true for a good number of people, there are a lot of sensitivities that stem, in my opinion, from certain plants, be it veggies or even fruits. It doesn't really matter. Your sensitivity vary from person to person. That even if you take the first step and remove all the processed carbs, or even if you remove all carbs for the matter, like on a strict keto diet, you might still have issues. And I had that, and I noticed there are specific plants that I absolutely cannot have without feeling almost immediate symptoms.
Do you mind I ask which ones that really trigger you?
For me is onions, garlic, leafy greens,
Uh-huh.
artichokes, so stuff with inulin,
Yeah.
with certain fibers, right?
Yeah.
I've
Absolutely.
noticed is a big issue, and funny enough, then other things like that I would say arguably maybe even worse, like wheat, not so much of an issue. So
Really?
I can eat a
Okay.
whole pizza and I feel fine, but if I look at an artichoke, I'm bloated.
Yeah, I know. Yeah, they do ferment. Those carbs and things like artichokes are just like cause like a wildfire reaction. I mean, in terms of like the bacteria just again have a heyday, I think, in a lot of people. I'm similar with especially okra. We don't get a lot here where I live, and so we were celebrating, went out to eat and had okra, and oh man, that night was rough.
Yeah.
It just also just the I think too, like, to a degree I wasn't used to it, and I ate a lot of it. There's, I think, a component of the amount. But I agree, some of the same components. What's weird for me is onions are totally fine. Garlic, no. Garlic's a no. And I don't know, there's just subtleties for everyone. And I think that just points to the fact that, yes, you really have to individualize and tailor your diet regardless of what anyone has told you.
Yeah.
I've had, people, like in my family where they were told, like, they had IBS and the doctor just said, well, just eat more fiber, just eat more fiber, and at the end of the day, they just felt even worse,
Yeah.
more frustrated, no tools. And, it's, the fiber thing is a very sticky, contentious topic because it gets a green light by so many healthcare professionals, and ultimately the fiber, it's just not like it's an apple and an orange, like, the inulin in okra versus, the the wheat lectins and there's so many components that, and some people, like, say you do fine with pizza. Yeah, I've been there too, and then you eat like a whole grain cereal and it wreaks havoc. It's
Yeah.
the grain, the whole component.
Yeah. Yeah.
So
I seem to be doing much better with the least amount of fiber in my diet. And, and again, there are so many. The problem really is, I think, twofold. One is that most of us eat so many different things every day that it's very difficult to pinpoint what's causing your issues or what's causing most of your issues, right?
right.
And if you really, and we, when I went to the doctor, he said, well, just, try out certain things and remove certain foods. But if you just remove one food, and I still eat 20 of other different foods, on a given day, I'm going to be experimenting for the rest of my life. And we
Right.
likely never find out what it is, because sometimes it's also the combination of certain foods, not not the
Absolutely.
individual one, but you eat two and suddenly you have an issue. Whereas if you eat them individually, it's fine. Or it might be, one day you're more stressed and you're more susceptible to those issues, whereas on another day where you're relaxed, maybe, you handle it fine. And so for me, like, really, doing like a clean kind of slate, removing everything that could potentially be the issue, and then
Right.
reintroducing them one by one, I felt like is easier, and I get quicker to where I want to be, to find out what is causing an issue and what is not, versus
Right.
continue eating everything and then just removing one by one. Because sometimes you eat something for a day and it's fine, you eat it for 2 days, it's fine, you eat it for 3 days and it's not fine anymore, or in vice versa, you remove something for one day, no difference. But if you were to continue avoiding that food for several days in a row, sometimes even several weeks, depending on sometimes your gut microbiota takes time to restructure to let the bad bacteria die off and to let some of the good ones move in. That doesn't always happen overnight.
Exactly.
Right.
Yep. Yeah, it's true.
And yeah, but and the other thing is really that there is so much. I think most people and most doctors, most healthcare professionals don't believe that you can fix your gut issues by dietary changes. That's
Yeah,
one of
that's
the most pushbacks I've been getting is, well, you're not really fixing the problem. You're just removing, the food that's causing the issue. I'm like, well, if you have, if you smoke cigarettes, stopping, cigarette smoke is, it might prevent, from lung cancer. You fix the problem, because you shouldn't be smoking in the first place, right? And there are certain foods that you maybe shouldn't be having, or humans shouldn't be having in general, like
yeah.
over-processed carbohydrates, right? There is really no good reason to consume those. And so, yes, you are fixing the problem. You're not just, limiting yourself and, you know, to
Right.
avoid the occurrence of the issue.
Right.
But
I exactly.
they don't.
Yeah, they don't get trained, and I think unless they, and some do on their own, but that's just not part of the training process, even learning about foods. And but I agree with you, starting out and just, and I've actually warmed up to that idea a lot of just stripping it down to, like meats and of high quality meats.
Right.
And because they really are for a lot of people. I don't think people tend to believe it though until they actually do it, because it's such a it's a belief that they can't get behind because everybody in the world has told them that's not the way to do it.
Right. Yeah.
It's very, I think it takes a very strong disposition in a person to say, yeah, I'm going to do that. I'm going to go against everything I've been told and do that, and then add things in. So I think the only people who really experience that benefit are a very select few people who are willing to do that. So that's the world, I'm working in the context of all the people that have all these beliefs, and you have to work around their beliefs. And,
Mm-hmm.
I think that's where I think, there are the tools that, yes, you can do that. And I think it's super beneficial to strip down the diet to just the basic, because you have to have the protein building blocks. That's just not, you could argue that legumes could be an option, but they really are not, because they are one of the biggest gut triggers. In my book, I talk about that it's sometimes causal in things like irritable bowel. In legumes are just a rough thing for so many people's gut. I'm not saying everybody. I've met many people are like, oh no, legumes are fine for me, and then like, fine, great, that's fine, and I'm glad they are for you. That's works great. It's just that by and large, they have some of the highest anti-nutrient compounds that really cause gut pain, and the anti-nutrients they disrupt the gut lining and cause leaky gut. And there's just so many reasons that they would not be the protein choice for many if they really are trying to heal. And of course, organ meats being, I have to put the plug in for organ meats, and I know we're on the same page, and I love organ meats. I incorporate many every single day. That's the one thing I'm very faithful with. Interestingly, my skin, everything, it helps a ton, approaching 50. And I just feel like it's like, I can't live without it. And like, I want to say the ones that are really important to my health right now are, of course, the bone and marrow, liver, and also this intestinal, grass-fed intestines. Are game changers every single day. So, yeah. And I know you've got a new product that's coming out with intestines in it too. So I'm excited to try that, and kidney and things. So, yeah.
Yep.
But healing in a traditional sense. And, I think we had talked before that, in nature, our animals eat the organs first. And I actually witnessed this because Michael, I give this to my cat. I always give my cats and dogs some organ meats too. And they will eat around, they will eat it first, always.
Yeah.
So I think we are hardwired to need the nutritional and the components we can't even fully understand. And these organ meats are beyond, we know there's lots of antioxidants, but there's essential, biodirectors in organ meats that are
and
healing.
even like certain omnivores, because we have chickens, right? And so the other day we had like some liver pate that was already too long in the freezer, and we didn't want to eat it anymore. And plus, my recipe wasn't really that great for that batch. And so we fed it to the chickens, and they would go nuts. I mean, they have free choice. They're corn and soy free, organic grains, and the best chicken feed we can buy. But anytime there is animal protein, and in particular organ meat involved, they go nuts for that, and they don't even look at anything else. And those are chickens. They're opportunistic omnivores. I mean, they are like insect-leaning, I guess, omnivores, but nevertheless, they can eat whatever, plants, meat, animals, and they gravitate to organs and to animal protein in general. And if you just observe nature, that should tell you something of how we as meat-leaning omnivores, I would consider humans to be, what we should be gravitating towards as well. Unfortunately, many of us have lost the taste and desire to eat those things. But that's an acquired, I guess, distaste. Is that the right word?
Right. Yeah, definitely. I grew up with some of it. I can't convince my own family too much of it, but I still get it in with, my supplements and whenever I can, otherwise, pate and things like that. So
Maybe let's talk about, because you made a very important point. I mean, maybe, arguably, hypothetically, let's say, eating only meat for a while and removing everything else from your diet might lead to the quickest success in terms of healing your gut. Most people, for various reasons, are not going to do that and can't even wrap their head around eating something that everyone tells them causes, cancer and heart attacks and whatnot. So what do you do to kind of lead people, towards the goal of eating better, of removing certain foods without telling them, starting tomorrow, you cannot have any of the stuff that you've been eating for the past few decades? How do you approach that? What are some of the, you already mentioned processed carbs. I think that's more or less a no-brainer. I think most people should understand that processed carbs aren't good for you. Added sugar isn't good for you. If someone, doesn't understand that, it's probably it's a difficult conversation. But most people understand, right? But from there, where do you go? And then maybe in particular, just to already put it out there, what do you tell someone who is vegan? Because I have a lot of people come to me and said, I can't eat meat because I'm vegan. So what can I do to fix my IBS? And I'm like,
yeah,
I don't know. I mean, I wish I could help you, but what is your take on this?
Yeah, I think, and lots of people these days come and go in and out of veganism, and I respect those decisions, and for whatever reasons they choose that, and they're doing the best they can for what they know. And I'm not saying there's no chance you could be vegan and be healthy, because I think there's a chance. Some people can do it okay and be fine. The average person, however, I think it makes their guts pretty wrecked, and I think regardless of whether they do it well or not, whatever the protein choice they choose or not, there's just so many anti-nutrients in those foods, and that's nature's design, is to make plants hospitable to whoever eats them, because they also want to survive. It's their natural defense to cause issues for us and deter us from eating them. So eventually, most vegans I've met do not stay vegan, and
That's like a statistic, like 80% or so return to eating meat because of health issues, right?
right, that they become sick, and whether it be they can't have any energy or their guts wrecked or both. And I think it's just that they have to come to that on their own. If they, usually they aren't coming to me with, you know, wanting, if they're coming to me, they're ready for change and feeling
Right.
better. So, I think, it's, yeah, but for the average person who's been told, all these conflicting, eat plant-based, and they're confused, and what I tend to do for people is that at that point just talk to them about the attributes that you're getting in whole foods, like say why you need more protein, and I think that's definitely like a low-hanging fruit for many people. Just eat more quality protein at meals, because it's the structure of the gut lining, it's the structure of muscles. You're going to feel stronger, you're going to feel less bloating, and actually there's research to show that high quality protein foods actually promote a healthy gut microbiota, and that's fairly new. I talk a lot about that in my book, that no, it's not necessarily fiber, but high quality protein that really helps the gut microbiome. And I think that's definitely an about face for a lot of people. I don't think many people have actually read that research. And I've even talked to my peers about it, and they look at me like, what are you talking about? I've never heard of that. And I'm like, oh no, this is real. It's real new research of how, and even like, animal protein based, compounds like colostrum we've talked about before, and I use that as really beneficial for the gut lining and the gut microbiome, and definitely an animal-based product. But at a minimum, if you can do that, helps heal the gut lining, things like that. So my approach tends to be more of like, well, not really like negating their thoughts about like plant-based, but to point out that, well, these proteins are going to absorb really well. Let's just see what happens if you go without the triggers, like the main thing. They may tell me something I already know, like, okay, I eat these foods and I feel bloated on these days, and then I kind of hone in on that and say, okay, well then let's work around that and just try to do without those foods that are really triggering you. So whether it's onions, garlic, those are the high fermentable foods that can be triggering, so just getting rid of those. If you have to have something starchy, have just white rice, or some, because it's not as fermentable, those types of things.
That's funny enough, when we look at, okay, how can we incorporate certain carbohydrates, and soaking white rice, not brown rice, which has more of the anti-nutrients, but plain white rice that was stripped of all the stuff that you don't want to have. Because if you think about it, those carbs, they're not really a source of nutrients. You eat them because you like the taste, or they fill you up or whatever. But it's not. We don't eat them because there are so many good B vitamins or whatever in rice. There isn't.
Right.
But if you soak it, white rice, we can handle that fairly well, and we have that on occasion, and much better than many of the other starchy veggies, maybe even potatoes. We've even experimented with fermenting sweet potatoes. Peel them, cut them, ferment them in a brine for a couple of days, and it's better than regular potatoes, but it's still we still feel more of an impact than just having plain old rice that was soaked overnight, and then the water started.
Right.
What's your take on raw milk?
I wish I could get my hands on some. No, I think it's
in Montana either.
I think it's coming around. It's legal. But it's very difficult to find. I know somebody was telling me the other day it's available in the store. I'm just not a milk drinker. I like milk products, but milk drinking. Do you have raw milk?
Yeah, I mean, it's sold as pet food here in Georgia, because it's otherwise. But yes, we do consume quite a bit of. I've been making kefir for a while. But now we just, drink it, straight up. My son really likes it. My daughter doesn't like it. Kathy, my wife, doesn't care for it either. But my son and I, we consume quite a bit of milk. And we just bought a property, and we're going to have our own dairy cows. I'm looking forward to getting colostrum and, cream and all of those things, like straight from the teat, so to say.
Right, that's awesome. Yeah, I grew up having my aunt, like goats and raw goat milk. And I had this conversation with my aunt. She's like, oh, man, it's just the best. And, people just who can't tolerate anything else, the raw milk is it. And I totally believe it. I've read tons of accounts of it. And it's really just more a live food that has, all of the things we need, enzymes and bioactive compounds that just, yeah, I fully believe it's great. And I mean, I kind of understand the whole rationale behind pasteurization, but it makes it dead. It makes it
That's true.
not good. It's good.
Yeah. Yeah, and I can tell
Nutrition.
when both my wife and I, when we consume pasteurized milk, even if it's like the low temp pasteurization, I think that's like the best milk you can buy. And even if it's, organic, grass fed, A2, all checks all the marks, but it's still pasteurized. I break out, my skin breaks out here on the side, uh, bad breath, so you can tell there is something going on in your digestive system that's not good. And it never happened with raw milk.
I see. Yeah, that's great. Yeah, I hope it gets traction going, and that's I think it's definitely healing, and I'm all on board if I can get my hands on some is the
Right.
big thing.
Yeah.
Yeah, it'll be great. Yeah, that's it. Yeah.
All right, so to recap, so you focus on making sure, your patients get enough protein, ideally from animal-based sources, high-quality animal-based sources that they got. And I guess by increasing your protein intake, you decrease your intake of some of the other things that might cause it
Absolutely.
automatically, right? And so
Yes.
we, helps on both sides, so to say.
Yeah, they lose weight usually, right? And always happy about that and get more lean, and yeah, it's a win-win, and brain health improves when you just don't have all that brain fog from all that junk. And yeah, definitely incorporation of, plants within, and I do use plants and herbs and a fair bit, especially herbs and medicinally, and whether it's for this or that, but I could tell you, like, peppermint being one of the easiest, quickest remedies for a lot of IBS pain and spasms. And I've had such great success. People just, I'm like, just try this. I end up like, sometimes just buying it for my family, or just please try it, things like that. And usually they're not disappointed. Just getting things, because regardless of what I believe, not all my family members are on board with what I believe, or my friends, or just, so sometimes the herbal remedies are at least help symptoms in ways that don't have the negative side effects of
Right.
drug therapy. So
Yeah, no, absolutely. We've also peppermint capsules at home. The other thing that we noticed is, have you ever experimented with ozone capsules? Like
I
ozone
have,
suspended in olive oil?
well, maybe slightly different. Mine was like a magnesium ozone compound. It's been a bit, but what did you notice?
Well, so anytime we since we have animals, the kids never wash their hands. They grab the chickens so that they cuddle with them, and occasionally they get something in their stomach, and they feel like a little funky in their stomach for a couple of hours. And we've noticed that with ozone oil, I don't even know the exact mechanism. I know how it works against, like, bacterial overgrowth, etc. But it seems so the ozone suspended, or the ozonides, I guess it's called, because ozone reacts immediately whatever it comes in contact with, right? So it's not a stable molecule.
Right.
But those ozonides that are formed when the ozone gets suspended in olive oil, those seem to be inflammatory in the sense that it upregulates your immune system temporarily. So it acts like as a mild hormetic stressor of sort,
Right.
right? To get your immune system to respond more forcefully, maybe.
Right.
And it can also destroy bacteria and viruses on contact, which is one of the reasons why ozone is used, like in swimming pools and stuff, as a disinfectant, or even in dental practices. And I've been
Right.
experimenting with ozone, like, as an IV, and different modalities. But the ozone capsules, they are really, we found convenient and effective for like acute gut issues. You just pop two of those, and issues go away relatively quickly. Now, obviously, that's not it's a band-aid at the end of the day. It's not going to fix the root cause. But if you're in a pinch and you're somewhere out and about, and you don't have anything else, you don't have your fresh peppermint that you might be growing at home for that matter, those capsules seem to be very effective too.
Interesting. Yeah, I'll definitely have to look more into that. I think, yeah, it's kind of similar along the lines. Have you tried activated charcoal, like a coconut charcoal, kind of a similar concept
Yeah.
that it just binds everything in it and like around it? I don't find it works in some scenarios, like say if I eat spicy foods. For me, it doesn't work like if eating gluten, and which I do occasionally. I've definitely like gone back to fully gluten free. I go in and out of that because of more than anything is for me the skin issues that occur when I eat gluten, but also just gut distress. I'm 100% confident I shouldn't eat gluten,
Right.
but the when it comes to the charcoal, yeah, it does really have a benefit for heartburn and IBS, especially if you catch it right when you're having that trigger food. Or for me, when I occasionally have alcohol, which is perhaps once every 2 months. I'm not a drinker. It's pretty negative for me, but occasionally do. I carry my charcoal with me to the bar and I'm fine. I'm fine. I can
One
sleep.
capsule and one shot. One capsule, one shot.
That's it. Yeah, exactly. And then I think that's also, I forgot to mention a low hanging fruit. I think most people don't realize how toxic alcohol is to the gut lining. And it's just a no-go if you want to have a healthy gut. And I can't say it's easy to give up, but it's definitely a smart thing to do or limit.
With alcohol, it really is. Its effects really, linger for several days, especially as far as the gut is concerned. If there is a disruption or a change in your gut microbiota because of alcohol consumption, I mean, the gut is, I think, an organ that can heal relatively quickly overall.
Yes.
It can, regenerate cells incredibly quickly. But nevertheless, if there is a shift in your bacterial composition, getting that back to baseline or where it should be can take several days. So even if you say, oh, I only drink, 3 times a week, that's probably enough to keep it perpetually in a bad state, right?
Exactly.
If
It
you
is.
Monday, Wednesday, Friday or something like that, you're gonna be always impacted and never give your gut enough break or your microbiota to recover.
Absolutely. And hormonally, I can't speak for men, but I know I talked to countless people that women, just cannot, like their moods suffer a ton, just one drink once in a while. And it's, I don't know that everybody's as in tune as they need to be on that one, but it's definitely a take home message is if you have gut issues, it's something that's got to go. It really does. And it just blocks all nutrients, almost every nutrient is blocked by alcohol.
Yeah.
Well,
So having a steak with a glass of red wine, you only get like half out of the steak that you could otherwise.
right. Exactly.
Yeah. So
Right.
if you drink at noon and then wait until dinner to have your food.
Right. And I don't think, there's the alcohol that they have in the Mediterranean. It's more about the, resveratrol than it is about the alcohol as far as the long-term cardiovascular benefits anyway. And, and when they look at the traditional Mediterranean diet where red wine is consumed a lot, they live in a very sunny place where they have social connections and more in touch with nature, and it's just a whole
Wine that's making certain people healthier in those regions. And there is, I mean, there probably many people have seen it. The new vegan propaganda film on Netflix about the blue zones.
right.
The complete BS.
It is.
And so it's not the wine. It's not the plants that people eat in those regions. If there are regions where people actually get older, if you take all the, pension fraud and missing birth certificates out of the equation, whatever is left,
Right.
probably other factors, and not the alcohol and
Right.
not the plants that they might or might not be eating. But yeah,
For sure.
so what other, I mean, it's a kind of a little bit of a dangerous topic, I think, because if you mention, supplements that can help, like, peppermint or ozone or charcoal or, colostrum, a lot of people think, well, I can, or even, maybe, digestive enzymes. I've noticed that in particular in the combination with gluten, there are certain digestive enzymes that if you take with your meal, it breaks apart, those things that are hard to digest, so that might be causing issues, and you're probably going to have significantly fewer issues. The
Right.
problem with all of that is, people use those as band-aids, right? They continue
They do.
eating a regular diet and then just, try to mitigate as much as they can with supplements, and that's obviously not sustainable and not ideal, So
Right.
to be careful with that. But if you're, I guess, on a path to healing and you just want to feel better while you do that, and if you're not like me who, just can change the diet starting today, and change everything without looking back. Most people don't do that. So if they need kind
Right.
of to ease themselves in, for those, certain supplements can help, ease the pain, I
Absolutely.
guess, and get them, keep them motivated, I guess, to keep going.
Absolutely. Yeah, I think that's where, the meeting them where they're at as far as just the seeing the potential to feel better. It's, adding in, enzymes do really, and I think, especially in the inflamed gut, because the inflamed gut is not making enough enzymes. It's so those things can be really beneficial, and the risk being quite low because they're all food derived. But I agree, it is a crutch to a degree. They're one I don't use a lot for myself, except for a rescue. For people who are not willing to make as many changes as you and would be willing to do, yeah, I think it can be helpful. And I think the fact that they can see the difference quickly is an aha moment. Like, this does not necessarily take Prilosec to feel better. Like,
Right.
it's a far better use than the prescription drugs and over the counter drugs. Because if you talk about, like, say, for example, omeprazole and the long-term risks of memory loss and dementia and cardiovascular disease and bone loss, and the list goes on, and I just getting someone off of that is like a huge win.
Right. Yeah.
So, yeah.
Maybe let's talk about that real quick before we wrap it up. Um, Acid reflux and heartburn, right? The standard, if you go to a doctor, say you have acid reflux, you get acid blockers, right?
Right.
Based on what I have learned, the issue when you have heartburn is not really too much acid. It's that the acid spills up from your small intestines because your stomach is not producing enough to digest the food. So by blocking
Right.
all of that, it's really counterproductive, and it has a lot of side effects in the long term that are
Right.
absolutely not good, right? So what can people do if they, and the other, and it's similar to this, I think, is if people have not eaten meat, animal proteins, animal fats in a long time, and they suddenly start incorporating more of that, they might not have, as you said, enough enzymes to break down the fats and the proteins, and they might feel nauseous or heartburn, etc. What can people do to kind of help their body make more of the bile juices and digestive enzymes without feeling sick or bad in the process?
Yeah, I think it's, yeah, feeling the heartburn. I actually think I've seen it the opposite. I mean, tell me if you've seen differently, but when someone ditches a lot of the plant-based carbs and then adds more meat, they actually have less heartburn.
Right.
It may take a few days, but I think because animal protein specifically, increases stomach acid, and that you need acid in the stomach for the lower sphincter out of the stomach to open up. When people have too low of stomach acid, it causes the stomach to have improper emptying, and so then low acid can actually be more of a trigger for reflux or heartburn, and then the opposite. So actually, too low of acid is a big problem in the vegetarian diet and vegan diet perhaps as why they may have, problems. Again, yeah, adding enzymes in at that time is helpful, I think, a lot of the times, and just to reduce any transition period like that. They're gonna be helpful. They don't have any risks, and so that's where they come in handy. But I don't know, maybe there could be the exception to the rule. If they drastically change quickly, they might have to suffer a bit, because your gut gets accustomed to whatever you're doing. So shifts definitely can create some discomfort no matter what you do. But yeah, I think the use, and then I forgot to mention too, that the use of those stomach blocking medications, I saw recently a study, people are 4 times more likely to get admitted to the hospital with any kind of like severe infection. So because there's no stomach acid, it creates an imbalance in the gut bacteria, allowing for harmful bacteria to enter the body. That's a major risk with these drugs, and they're rarely the answer. And the problem is they may be prescribed them for whatever reason, but they just continue to get it refilled over and over again mindlessly without the knowledge of the bad long-term side effects. So, yeah.
Right. What's your take on apple cider vinegar?
Oh, I love apple cider vinegar. I think almost everybody responds well to it. And it's kind of a proof of concept. Like, say, if you feel better when you have it, that's often a sign your stomach's too low in acid. Although I think there's more to it than that, because it's got these fermented compounds in them. And I've never felt like my stomach acid was low, but I always feel good still when I eat it. I think it's the fermentation, and there really is very little scientific evidence of it being beneficial. Although one interesting study I was trying to find for a patient, because they got a lot of muscle cramping, was that it helps calm down the nerves. Weirdly enough, there was a study about it being good for the nervous system. Again, that's good for the stomach too, but yeah. What's your experience with it?
I mean, I don't use it regularly. I've used it for a while just to experiment, to get like to prepare my stomach like for a big, meal coming down the pike. But the only thing that I'm cautious about is when I drink it like in liquid form. If it's a capsule, it's not a problem, but it can, potentially cause issues, with your teeth if you expose, the acid in the apple cider vinegar to your teeth, or your teeth to the apple cider vinegar. And so that's the only concern, when people drink that a lot, there might be downsides as far as your dental health is concerned. So I kind of prefer, capsules, like gel capsules,
Sure.
where it bypasses, your teeth and goes where it should go.
Right.
But yeah, I'm not a regular user of it, but occasionally, one thing I've noticed, I don't have a lot of hiccups, but every so often when I have it and I take 2 spoons of apple cider vinegar, it's gone immediately.
It's amazing. Yeah.
I don't know why or how, but it works.
Maybe it's a nervous
Every
system
single time.
thing. Yeah, that's fascinating. It's a good remedy then.
Yeah.
Yeah, maybe it is the innervation that it calms down because the diaphragm is, for whatever reason, not misfiring, So yeah, I agree. No, I think it's a huge one. As far as, there's also the test for stomach acid you can do where you have baking soda, and if you, it's a time test. If you don't burp after eating baking soda, or a small amount, a quarter teaspoon, you don't want to eat a lot of it, but if you don't, it's baking soda and acid react and they bubble up, and so you get a burp. If you don't get a burp, you don't have enough stomach acid. So that's a fairly, and the reason stomach acid, again, is important, it kills off dangerous microbes, but it also helps digest protein. It helps digest the food you're going to eat, and then, even fights off harmful bacteria that may come your way. So blocking that acid is dangerous unless you absolutely have to, for valid reasons, like you've had a stomach bleed or an ulcer. So there are times and places, of course. So, but they're usually short term, and they need to be short term.
Right. All right, cool. Well, thank you very much. I think with that, we're going to wrap it up. But before we do, what is the title of your book and where can people find it?
Yes, my new book was released in July. It's called Gut Fix. You can find it on Amazon. You can also find it on Barnes & Noble and on my website, which is The Healthy RD.
All right, sounds good. Well, I'm going to include all of that in the show notes so people can, find that, click on it, and also, your social profile and, any information you've given me so people can reach out to you, find you, follow you, etc. With that, we're going to wrap it up. I thank you so much for spending the time with me, for talking about gut issues, something that unfortunately affects, I want to say most people in this country.
Absolutely.
And so hopefully, whoever is listening or listened can get a couple of tips and fix those issues, because they absolutely can be fixed. There is no need to live with those issues every single day, and to maybe plan around, plan your trips around, where toilets are available, etc. I've heard horror stories from people who live an absolutely miserable life because of their gut issues. There is hope. There is a fix. You can cure them by just making a couple of simple lifestyle choices, including diet, nutrient-dense, eating nutrient-dense foods, and mitigating some of the stress, and that's it. I mean, it's fairly simple. It's not easy, but it's simple.
Absolutely. Agreed. Very simple. So thank you so much, Michael.
Cool. Thank you. Appreciate it. And I'll ping you when the episode is out.